The next test is the modified Allen test. So with the modified Allen test, you're making sure that there isn't an occlusion or obstruction of the ulnar artery. So how you perform this test is you have your patient clench their fist really tight, and then you're going to push down with your thumbs on both the radial and the ulnar artery. And then you're going to have your patient unclench their fist, and their hands should be white. And then you're going to remove your thumb from just the ulnar artery, and this is checking to make sure that there's still blood flow to the hand, and their hand should turn pink within 15 seconds. So the modified Allen test would be performed in a hospital. Say that a patient was coming in and was going to have a procedure done where a catheter was going to be stuck up their radial artery. So you would perform this test because beforehand you want to make sure that their ulnar artery isn't obstructed in any way, because if you were to stuck a catheter up the radial artery and the ulnar artery was obstructed in some type of way, now the hand isn't receiving any blood flow, and this is just going to make sure that during the procedure your hand is still receiving adequate blood. So next we're going to be doing the modified Allen test. So you're going to have your patient's hand, you're going to have them clench their fist really tight. You're going to push down on both the radial and the ulnar artery. You're going to have them let go of their fist. Their hand should turn white, and then you're going to let go of the ulnar artery, and this is just testing to make sure that there's adequate blood flow of the ulnar artery and that it's not occluded, and their hand should turn red again in less than 15 seconds. The capillary refill test is when you press down on your patient's nail bed until it turns white, and then you let go, and then it should turn pink within less than 3 seconds. And this is testing to make sure that there's adequate blood flow to the finger. Next we're going to be doing the capillary refill test, and this is just checking to make sure that there's good blood flow to the fingertips. So first you're going to have your patient's hand, you're going to push down on their nail bed so it turns white, you're going to let go, and then it should turn red in less than 3 seconds. So for the nursing profession, you're always going to be dealing with blood vessels, just because the blood vessels are what's supplying the blood to all of the organs, and those are vital in order to stay alive. So one condition that I'm probably going to be seeing a lot of is varicose veins. So varicose veins are when the venous valves are faulty, and usually the venous valves prevent backflow of blood. But when they're faulty, now it's allowing blood to go backwards in the vein, and then this can cause a pool of blood, and in some cases it could cause varicose veins. So varicose veins are when the veins become all twisty and enlarged because of a backflow of blood. Another condition that I'll probably see a lot in my nursing profession is a deep vein thrombosis. So a deep vein thrombosis is caused because a person isn't moving for a long period of time, and so it's causing their blood to just pool in one area, which could cause a clot. And these can be really, really painful for a person. And these can become dangerous if the clot breaks off and forms an embolus. And an embolus is a blood clot that's now traveling throughout the body, and the blood clot could now travel to the lungs and become a pulmonary embolus and could obstruct the airway. So a great way to prevent a deep vein thrombosis from forming is making sure that you're moving every few hours if you're sitting down for a long time, just so your skeletal muscle is contracting and your blood is still circulating throughout your body. So another condition that I might see in my nursing profession is Buerger's disease. So Buerger's disease is when the small and medium-sized blood vessels begin swelling and a blood clot could possibly form. And this is a lot of times because it's either an autoimmune disease, it's a genetic predisposition, or it's because of tobacco use. And so this could become dangerous because if the clot forms and the hand or the foot loses oxygen for a long time, you might have to amputate it because the tissue would be dead. Another condition that I might see in my nursing profession is arteriosclerosis. So arteriosclerosis is when there's a bit of a plaque in some of the blood vessels, and so this could be because somebody smokes or they have a really bad diet, and this could be dangerous because now there's an obstruction in your blood vessels and now blood isn't able to properly flow through it. Another condition that I might see in my nursing profession is frostbite. So frostbite is when somebody's out in the cold for a really, really long time, and now instead of the body having the blood circulate like normal, all the blood is now going to go toward the center of the body, toward the vital organs, because now there isn't going to be as much blood flow to your hands and feet because those aren't as important as, say, like your liver or your kidneys or something like that. So in a lot of really bad cases, fingers could turn like a dark purple color, and in some cases they might even need to be amputated if blood flow is obstructed for a really long period of time.